Let's talk about gestational diabetes, maternal fetal complications, increased risk for preeclampsia, C-section rate 20% versus 10% in non-diabetics. 70% of gestational diabetics will have diabetes in 20 years. Fetal complications, macrosomia, neonatal hypoglycemia, hyperbilirubinemia, shoulder dystocia, birth trauma, stillbirth, adult obesity, and diabetes. We screen at 24 weeks. We can also do early screen for pre-gestational or early gestational diabetes with a 75-gram oral test. Who should be getting these early screening? If you have a BMI of 25, or if you're Asian, it's 23, plus one of the following risk factors: physical inactivity, first degree relatives with diabetes, high risk race or ethnicity such as African American, Latino, Asian American, Pacific Islander, have previously given birth to an infant weighing 4 grams or more, previous gestational diabetes, hypertension. If your HDL is less than 35 milligrams per deciliter, or your triglyceride is greater than 250 mg per deciliter, woman with PCOS. If your A1C is greater than or equal to 5.7, or impaired glucose tolerance, or impairs fasting glucose on previous tests. Other clinical conditions associated with insulin resistance, such as pre-pregnancy body mass greater than 40 kilos, or acanthosis nigricans, history of cardiovascular disease. So this is for screening to detect pre-gestational diabetes or early gestational diabetes. If you have only one abnormal value on the 3-hour, you have a significant risk of adverse perinatal outcome compared to one without any abnormalities. Diets: you should eat 40% of carbs, 40 of fat, and 20 of protein. 30-minute moderate intensity exercise 5 days a week. 10 to 15 minutes walk after each meal will improve glycemic control. Metformin does cross placenta. No long-term neonatal outcome follow-up is done. You can do 500 milligrams daily for 1 week, then BID. Creatinine is checked for baseline to ensure adequate renal function. Most common side effect: abdominal pain, diarrhea. Glyburide increase insulin secretion and sensitivity of the peripheral tissue. It's a sulfa drug. 2.5 to 20 milligrams daily. Data is limited on safety. Antenatal monitor starts 32 weeks, twice a week. Uncontrolled diabetes: consider delivering between 37 to 39 weeks. If EFW is 2500 plus, can recommend C-section. Repeat testing in 1 to 3 years if GDM and postpartum screening is negative.